Hey, welcome to Body Talk. Today we're going to be talking about STDs, sexually transmitted diseases. Hope you'll stay tuned.
Interesting information here, and hopefully the audience out there can gain some knowledge about some STDs.
Is it a big problem?
Yes, it is.
How many people, percentage of people would have an STD?
Well, I would advise to look on the CDC website.
Okay.
There's all kind of statistics regarding STDs, and actually we're going to replace the STD with STI, okay?
Okay.
Sexually transmitted infections. That's kind of what they're calling them now. And actually April, we're coming up on April, and that's actually the STI Awareness Month. So that's why I thought this would be a good topic today.
Didn't want to put it in February with Valentine's Day, I guess.
No,
Just
probably
put on
not.
April Fool's.
It just would probably diminish the romance there
Yeah.
or somehow. But anyway, anybody can get an STI just by having unprotected anal, vaginal, or oral sex.
Something where you're exchanging fluids?
Correct.
Whether it's blood or whatever?
Body fluids, correct.
How about spit?
Sure, saliva.
Saliva.
Absolutely. And so, if you're higher at risk if you have multiple sexual partners or anonymous sex partners, which kind of means more or less one-night stands.
Okay.
People you really don't know or don't even really know their name. And maybe they're just telling you a name and that's even not really their name. So, or, by having sex under the influence of drugs or alcohol, because our...
You make the best decisions when you're under the influence.
Oh yeah, yeah. Well, if you do, I want to join you and Deb sometime and see how that works out for you. But, drugs and alcohol, of course, lower our inhibitions and we become more risky. We allow ourselves to, be exposed to greater risk. I'm going to talk about a few here, chlamydia being the first. It's one of the most common sexually transmitted infections. All these affect both male and females.
So what would I be looking out for if I had chlamydia?
Well, you would be looking for any discharge from your penis or any burning when you urinate. Those are the two most common signs in men. For women, it's a vaginal discharge, sometimes not, as well as pelvic discomfort or pain.
Can that be cured?
It is. It's absolutely curable. But if left untreated, it can really cause some problems. It can make you, cause infertility in both men and women. Okay. So, but, and also with guys too, you're actually, if you have missed the signs of or just kind of blowing them off, if you've had burning when you urinate, and then it gets worse, it can actually cause swelling in your testicles. So, that's pretty alarming at that time. Yeah. So, you wouldn't want to get there. But, so yes, it is treatable with an antibiotic, the proper antibiotic.
Right.
But here's the clue, or the catch, I should say, that if your partner doesn't get treated, then it's not going to do you any good to get treated because you're just going to end up with it. So it's very important that in all these conditions that both you and your partner get treated. The next one I want to talk about is gonorrhea. It's another one that's
An
very,
oldie but a
very
goodie.
common. Yes, it is. AKA clap. You know,
Okay.
I'm sure you're familiar with that. Now, this one is more common in young people for some reason. But, you know, again, it affects both men and women. It can cause infections in the genitals, the rectal area, and the throat, especially if you're, you know, doing oral sex. So
Right.
again, it's that, you know.
So is there any, if you're looking out for it, is there any kind of rash or anything for
Well,
that?
you get the burning on urination, and men will have a white, yellow, or even green discharge coming from their penis.
Okay, we're going to the doctor for that one.
Yeah, I would hope. When it starts coming out green, that's a real
Yeah.
issue. And also, again, the painful, swollen testicles. For women, well, sometimes also men may not even have any symptoms, actually. But if you do have symptoms, that's what it's going to be.
Okay.
So, and the same with chlamydia. Men may not always have those symptoms. So I just want to make sure that everybody understands that this isn't always textbook. You know what I'm saying?
Now, of these things, you know, I've heard, I don't know how many of the things you're going to go over. Can you pick it up off of a toilet seat?
No, you cannot.
Or door handles or any other
No.
objects?
No.
It has to be person-to-person contact.
It does. It has to be exchange of blood and body fluid, not blood, but, well, yeah, you know, blood and body fluids
Right.
through unprotected sex.
Okay. So just
Okay.
going to a public restroom,
No.
you're not going to...
But you can get, like, you know, pubic lice or something off of toilet seats,
Okay.
you know, something like that. Just the little pest, but not an STI.
Okay.
Okay?
I know that's a thing that
yeah.
maybe somebody would...
Sure. Good question. Most women with gonorrhea also do not have symptoms. So you really never know if you have it, because often with women, you just develop like a bladder infection.
Yeah.
So, you know.
But the
you
same
really,
drugs or antibiotics...
Antibiotics
do they
it
cure
is
that or not?
curable. Yeah, it is curable with antibiotics.
So if you thought you had a UTI, would the same antibiotic cure both?
Not always, no.
Okay.
So, you know, my advice is if you've had multiple partners and you go in with a urinary tract infection where you're having burning when you urinate, so you're going to automatically suspect, okay, well, I've got a urinary tract infection.
Do they test for this when you do the pee test?
Well, they may talk to you about your sexual health at that time, and that's
Okay.
where you need to really be open and honest about what, you know.
That's where guys usually don't have
Right. They
UTIs.
Right. And they don't. They truly don't.
Yeah.
Women have
I've had
it
a
more.
few. That's probably more because of kidney stones.
Yeah. Yeah, those wonderful, painful, very
Yes.
painful kidney
Yeah,
stones.
you know when you got one.
Oh my, that's what I've heard. I've never had one, but that's what I hear. And I've seen a lot of people, you know, come in with them. But both chlamydia and gonorrhea can be detected through urine.
Okay.
It's just a pee cup, and, you know, they can test it and send it to the lab. It has to be tested to the
Okay.
lab. But so again, it's important that if you have a partner, or if you don't and you know who you've had sex with, then you need to let that person know, you know, so that they can get treatment and get it stopped so it doesn't continue getting
Right.
passed on.
Which is a good idea to use protection
Exactly.
condoms when you're with people that you don't really know.
Absolutely.
And they're not going to tell you everything.
They never are. They're
No.
probably not going to be honest with you, especially if they're really narcissistic, right? Because it's
Oh,
all
I
about
wouldn't do
them
that.
and their needs, you
Right.
know. But again, if these are left untreated, they're going to cause infertility, you know. It's going to damage the reproductive organs in both men and women. The next one I wanted to talk about is genital herpes.
And this is one you keep, you never get rid of.
You never get rid of this one, Mike. This will be around for the rest of your life. It may lay dormant, but you've got it. It's there. And so herpes simplex virus is caused by two types, type 1 or type 2. Now, type 1 is the fever blisters that you get here around your mouth.
And they're called herpes, and it ain't
Yes.
the same thing as what we're talking
It's
about.
not. It's HSV1 and it's HSV2. So HSV2 is the infection that's more common among men and women in the genital area. So HSV is always usually involving, you know, the skin or mucosa. But herpes is transmitted through the HSV lesion, herpes lesion. And
So you have to have a current outbreak to pass it on.
well, you know, as I was studying and reading about this, that's not always so. Let me just give some stats here for a second, then we'll get back to that. But the CDC estimates that 776,000 people in the U.S. get new herpes infections.
Okay.
So that's
not the total infected. That's the
no,
new
that's
ones
just new ones, you know,
per year.
per year.
Okay.
Nationwide, 15.7% of persons aged 14 to 49 have HSV2. Now, that is a nationwide statistic there.
Okay. 15, almost 16%.
Right. Of our population
Okay.
have.
I was thinking that was kind of higher, but okay.
Yeah, well, that's pretty, I mean, and you know, and then you add the 776 on, I mean, so it's ongoing. It's
Right.
going to just climb. But generally, a person can only get HSV2 through genital contact. So, these people know that they have herpes, but it lays dormant, but you can still get it. Okay? So, you know, you can get the HSV2 infection if you receive oral sex from somebody that's got an HSV1 lesion here. Okay? So, yeah, through oral sex, you can contract that.
Okay.
Okay? And the HSV2 infection is even more common among women than men because, and I thought this was very interesting, because genital infection is more easily transmitted from men to women than women to men.
Okay.
So isn't that interesting? And that's during penile vaginal sex.
Right.
So again, you know, transmission.
It's probably the direction of the fluids moving.
I would
Guessing.
possibility. Yeah, that sounds pretty accurate, actually. Yeah.
Just guessing.
The symptoms are small, painful blisters on or around the genitals, the scrotum, the rectum, or the mouth.
Now, what kind of pain would that be?
I would say on a scale of 1 to 10, it would be up there. I'm guessing maybe about an 8. And it would be a burning pain,
Okay.
a burning, like like a fever blister,
Okay.
burning pain. The average incubation period is 4 days. So if you have sex with somebody on a Friday, come Tuesday, you've got this lesion. So, you know, that would be a consideration of HSV.
Okay.
And it can range from 2 to 12 days after exposure. But the incubation period is 4 days.
And then there's complications down the road if you wanted to have children or whatever,
Absolutely,
right?
because, and again, if you are pregnant and you have an STD, you must get treated. With HSV, if you have an active outbreak, you are not going to be allowed to deliver that baby vaginally because that can spread to the infant, the newborn, and get in the eyes or whatever and cause blindness. So very serious. So a lot of times they'll put these women that are pregnant on like an antiviral like acyclovir or Valtrex, and that kind of keeps it calm, keeps it down. A lot of times I used to hear that stress induces, the herpetic lesions.
Right.
It doesn't cause them, but it just kind of brings them out more, makes them surface.
Would you say that that's sort of similar to the chicken pox that becomes,
Yeah.
what is it when you're older?
It's actually the varicella virus. The shingles.
Shingles.
Yeah, that's actually along the same lines as that. Absolutely.
And I think stress and stuff brings on things for that too.
I agree with you for sure. But, here's the thing. Be considerate of others. If you do have HSV, herpes simplex virus, make sure that you refrain from having intercourse. And if you do have intercourse during your outbreak, then please use a condom.
Be considerate.
Exactly, because,
it's like the gift that keeps on giving.
Yeah. And that's not a gift you would want, is it?
Right, exactly.
But anyway, and so, yes, you need to avoid sex when there's an active outbreak and consistent condom use. So, and like I said, it can be treated with antiviral. Acyclovir is the drug of choice, and that's by prescription. Usually the HSV is diagnosed with
Blood test?
through a culture. They
Okay.
just kind of culture that
okay.
lesion.
Right.
Yeah. Now we'll move on to HPV.
Okay.
This is the human papillomavirus.
Is this something a little newer? I don't remember hearing about this when I was younger.
Well, it's newer to our generation, for sure. But it's one of the most common STIs in America.
Okay.
One of the most common. 79 million Americans, mostly in their late teens and early 20s, are infected with HPV.
So do you know you have this, and where do you look out
Not
for?
always. And there's many, many different strains.
And I see things on TV, advertisements about vaccinating
Yes.
for it.
Yes.
And then that too is a little, I don't know. I don't know if people actually trust doing that, or sometimes that is not the most healthy thing to do, or I don't know.
I'll be honest with you. I worked in an OB clinic for about 10 years, and we gave a lot of Gardasil to young girls, and I feel really good about that.
So is this something that can be cured?
It can't be cured. Well, can't be cured, but however, you can do several things to lower your chance of getting the outbreak, and that's to be vaccinated with the Gardasil. It's 2 doses for boys and girls. Back when I worked in the OBGYN office, we were just doing girls. So in the past 10 years, it has come out that boys can now get it. So, and for those who are who are 26 or under, that's who gets the Gardasil shots. They don't want to immunize anybody over 26, and I think that's because they encourage you to get routine cervical screening, because what HPV does, it can go into cervical cancer, penile cancer. So it's a very serious, STI.
Okay.
In most cases, HPV does go away on its own and doesn't cause any serious health problems.
Now, is that a rash?
Excuse me. It normally shows up as like warts, like flat warts, or just like a wart that you get on your hand, but it's down in your genital area, or it can get on a woman's cervix and cause an abnormal pap smear. And when that happens, then they do like, if the HPV's on the cervix, then they'll go in and they'll do what they call cryosurgery, which is where they freeze the cells there where that lesion's growing, so they can get rid of it that way. For men, you can get them on your penis. So if you ever suspect that you've got a wart, that you suspect it may be HPV, well, if it's in the genital area, most likely it is HPV. So you want to get that checked out. The sooner the better. And
so you brought some photos over. Have we covered anything with a photo?
No, we're getting ready to now.
Okay.
But let me just say this. I strongly encourage you that if you are out here listening and you are age 14 to 26, you need to get your HPV shot, Gardasil. It's so important. It's just a needle stick 2 times, and I think it's given like 2 to 3 months apart from each other. But there's hardly any side effects to it. It's not like other vaccinations that, you get concerned about with mercury and so forth. So I would strongly encourage you to get your Gardasil injections if you are a young man or a young lady and you are under age 26. And then we're going to talk about syphilis, and I'm bringing syphilis into the picture because, believe it or not, syphilis is on the rise.
That one always, I thought, had pretty scary ramifications. And
it is scary because you don't really, well, let me just go through the stages. There's 4 stages. There's primary, secondary, latent, and tertiary, okay? Syphilis is spread by direct contact with somebody that has syphilis, of course. And you develop these sores, okay? And so they can be, so if you're having vaginal, anal, or oral sex and this person has sores, then that most likely is syphilis. Because you can find them in or around the private area, around the rectum, lips, and mouth. The primary stage, that's the first stage, that's where there may be a single sore or multiple sores. And the sore is wherever this person has a sore or sores, that's the location that syphilis went into their body.
okay.
So usually it's genital, rectal, or oral, where you may see these sores. They are usually round, firm, and painless. The sores usually last 3 to 6 weeks and heal regardless of treatment. That's what's scary with this.
Well, that went away. Nothing to worry about, right?
Exactly. And so if the sore goes away, you still must receive treatment. Once you receive treatment, then it's done. It's over with. okay? But when you get a sore, it goes away. We don't think no more about that, do we? But maybe you should. So during the secondary stage, there's skin rashes. Oh, can we just show a picture of right there? So that's, so obviously the tongue is the primary site of where this first stage of syphilis occurred.
Now, is it the little red, the round
It's
things,
the
or is it the
little
white
round
stuff?
sores.
Okay, not the white stuff.
And the white stuff is probably, it looks like he's maybe,
Like thrush or something? Or?
yeah, he's got, yeah, it kind of looks like thrush, like yeast. But yeah, we're talking about the sores. So I don't know what, yeah, you're right. Looks like thrush, doesn't it?
Then you got the hands.
So this is the secondary stage. This is where you get skin rashes or mucous membrane lesions. That's lesions or sores in your mouth when I refer to mucous membranes. And the rash looks rough, red, or reddish brown, like spot-like. And it's a lot of times in the palms of your hands or on the bottom of your feet. So you've went from a sore on the tongue, but it went away. So now we're not doing
So it's popping
nothing.
out in different places.
Right. So then the last stage is the latent or tertiary stage. And this is when you, in the latent stage, there's no visible signs or symptoms at all. And so you can carry the syphilis in your body for years and years and not even know it. So, but the good news is syphilis is curable with the right antibiotics. So, and then the last thing is HIV, and of course it's come a long ways from, I think we talked about that the last time. And I do just want to tell you that, you know, if you are out there, you're single, you are not in a monogamous relationship, please use common sense, use protection, wrap it up, right? And you know, don't make poor choices. Don't use poor judgment. You know, look at the person you're with. If they're a stranger, you know, check them out. Check them out, and I mean it.
And two, you got to wonder, you know, like the one night stand thing, if they are willing to do it like very quickly with you, they may have done it very quickly with everybody else too.
And so that's a problem, yeah.
Right.
And you know, you often hear the saying, well, whoever you've been in the bed with in the past 10 years and you come along and have sex with somebody, well then they
slept
too.
with them
You're
also.
sleeping with the same 10 years of individuals that you've had sex with. So just wrap it up and use protection.
Yeah. Be safe out there, kids.
That's right.
And we'll see you next month on Body Talk. Thanks for watching.
Thank you.